If you are on Medicare and you take prescription drugs, I need you to stop what you are doing and listen to me for the next 10 minutes right now. The government just announced 5 days ago that a major subsidy keeping your drug plan premiums low is ending at the end of this year, December 31st. That means, starting January 2027, roughly 25 million seniors on standalone Medicare Part D plans could see their monthly premiums go up. Some of you will pay $10 more a month. Some of you could pay $20 more a month. And most of you have absolutely no idea this is coming. I am going to walk you through exactly what is changing, exactly how much more you might pay, and exactly what steps you need to take to protect yourself. Before we get into it, if you have a parent or a spouse or a neighbor on Medicare, do me a favor and send them this video because this affects all of them. And if you are new here, hit that subscribe button right now because I break down every single benefit change that affects seniors the moment it happens. All right, let me explain what just happened because the news is confusing people and I want you to understand the full picture before you make any decisions. On July 28, 2026, the Centers for Medicare and Medicaid Services announced they are ending something called the Part D Premium Stabilization Demonstration. Now, I know that sounds like government jargon, so let me break it down in plain English so it actually makes sense to you and your family tonight. Back in 2022, Congress passed the Inflation Reduction Act, and that law put a hard cap on how much you pay out of pocket for your drugs. That cap was $2,000 in 2025. It went up to $2,100 this year, and it is going to $2,400 in 2027. But here is the part nobody told you about. When the government capped your costs, somebody still had to pay for those expensive drugs behind the scenes. The insurance companies running your Part D plans suddenly had to cover a much bigger share of drug costs, and they panicked and tried to raise your premiums. So the Biden administration in 2024 created a temporary subsidy program that basically paid the insurance companies to keep your premiums down and stable. That program cut the average standalone drug plan premium by $26 a month in 2025 and $16 a month in 2026. And it worked. Enrollment in standalone Part D plans actually grew from 22.8 million in 2024 to 24.9 million right now. But the program cost taxpayers $9.8 billion over 2 years. And CMS Administrator Dr. Mehmet Oz just pulled the plug on it completely. Dr. Oz called it a bailout for big insurance companies and said the market has stabilized enough that insurers can now price their plans without government help. Now here is what that actually means for your wallet, because I know that is the only thing you really care about when you are sitting at the kitchen table. Right now in 2026, the average standalone Medicare Part D premium is about $36 a month. And that is with the subsidy holding it down. Without that subsidy, the Wall Street Journal reports that about 45% of enrollees will see their premiums jump by $11 to $20 per month. Dr. Oz says most people will pay less than $10 more, and some will actually see their premiums go down. But independent analysts are not so sure about that. The Kaiser Family Foundation says losing a $16 subsidy against a $36 premium is a huge proportional change, nearly a 45% increase. On top of the premium increase, your deductible is also going up from $615 this year to $700 in 2027. And your annual out-of-pocket cap is rising from $2,100 in 2026 to $2,400 in 2027. So let me add that up for you. If you are in the group that pays $20 more per month in premiums, that is $240 extra a year. Add the $85 deductible increase, add the $300 higher out-of-pocket cap, and you could be looking at over $600 more annually. Now, I know $600 might not sound like a lot to some people, but if you are living on a fixed Social Security check, that is real money out of your pocket. Here is the one piece of good news, though. The out-of-pocket cap still exists. So once you hit $2,400, your costs drop to zero for the year. And insulin is still capped at $35 a month. That did not change. and the 15 drugs with government-negotiated prices for 2027 are still locked in. So the protections from the Inflation Reduction Act are still there, but the cushion that was keeping your monthly premium artificially low is now gone for good. Now let me tell you about something that a lot of seniors miss, and it could save you hundreds or even thousands of dollars, so please pay close attention here. There is a program called Extra Help, and it is specifically designed to pay most or all of your Part D premium and drug costs if your income is low enough. If you are single and your income is below $23,940 a year and your assets are below $18,090, you may qualify. If you are married and living together and your combined income is below $32,460 with assets below $36,100, check this out. About 1 in 4 Part D enrollees already gets Extra Help, but the government estimates that millions more qualify and have never applied because they do not know it exists. You can apply online at socialsecurity.gov, or you can call Social Security directly at 1-800-772-1213 and ask them about it. If you get Extra Help, here is the big bonus. You do not pay the late enrollment penalty either. So there is absolutely no downside to checking your eligibility right now. Now, on top of Extra Help, many states run their own pharmaceutical assistance programs called SPAPs that can cover your premium or your copays, or sometimes both. To find out if your state has a program, go to Medicare.gov and search for State Pharmaceutical Assistance Program, or call your local SHIP counselor for free help. SHIP stands for State Health Insurance Assistance Program, and they have trained counselors in every single state who will sit with you and compare plans at no charge. You can reach SHIP by calling 1-877-839-2675. That is the national toll-free number, and they will connect you to your local office. All right, now let me talk about timing, because there are some very specific dates coming up that you need to have on your calendar, so grab a pen right now. By September 30th, your current plan is required by law to mail you a document called the Annual Notice of Change. And I need you to promise me you will open it. That document tells you exactly what your premium, deductible, copays, and drug formulary will look like in January 2027, and most people throw it away. Do not throw it away. Sit down with it at the kitchen table, read through every page, and compare what you are paying now to what they are charging you next year. Then, starting October 15th through December 7th, that is your open enrollment window, you can switch to any other Part D plan for any reason with no penalty. Go to medicare.gov/plan-compare, type in your zip code, enter every single drug you take, and the system will show you which plan costs the least. If you are not comfortable doing that online, call 1-800-633-4227. That is 1-800-MEDICARE, and they will walk you through it. Or call SHIP at 1-877-839-2675, and a real person will sit down with you on the phone and compare every plan available in your area. I cannot stress this enough. The cheapest premium is not always the cheapest plan, because your formulary and pharmacy network matter more than the monthly dollar amount. If you take a brand name medication, make sure it is still covered under Tier 2 or Tier 3 before you switch, or you could end up paying full price at the counter. Now, there is one more thing I want to warn you about, because I have been seeing this happening, and I do not want any of you to fall into this trap unprepared. Some analysts are saying that making traditional Medicare more expensive is a way to push seniors toward Medicare Advantage plans that bundle drug coverage for about $8. Medicare Advantage can be a good deal for some people, but you need to understand that those plans use narrower networks and require prior authorization more often. And in most states, if you switch from traditional Medicare to Medicare Advantage and later want to switch back, you may not be able to get a Medigap policy at standard rates. That means once you leave traditional Medicare, you could be locked into a network for years. And at our age, health needs can change in ways nobody can predict. So do not let a $20 premium increase scare you into switching without doing the full math on networks, specialists, and what happens if you need to switch back. Also remember that Medicare now offers the prescription payment plan, which lets you spread your out-of-pocket drug costs evenly across all 12 months of the year. It does not lower your total costs, but if you fill an expensive prescription in January, you do not have to pay hundreds of dollars up front at the pharmacy window. Alright, let me recap everything I just told you because I want you to walk away from this video knowing exactly what to do and exactly when to do it. Number 1. The Part D Premium Subsidy is ending December 31, 2026, and your standalone drug plan premium is likely going up in January 2027. Number 2. About 45% of enrollees could see an increase of $11 to $20 a month, and most others will see an increase under $10. Number 3. Your deductible goes from $615 to $700, and your out-of-pocket cap goes from $2,100 to $2,400. Number 4. Check if you qualify for extra help by calling 1-800-772-1213 or visiting socialsecurity.gov today, not tomorrow. Number 5. Open your annual notice of change when it arrives in September. Do not throw it away, and compare your 2027 costs to what you are paying now. Number 6. Use open enrollment October 15th through December 7th to shop for a better plan on Medicare.gov or with a free ship counselor at no cost to you. Number 7. Insulin is still $35 a month. The out-of-pocket cap still exists, and 15 drugs have government-negotiated prices locked in for 2027. If this video helped you understand what is coming, hit that like button right now because it tells the algorithm to show this video to more seniors who need to see it. Share this with your spouse, your parents, your neighbors, anyone you know on Medicare, because most of them have no idea this change was announced 5 days ago. Drop a comment below and tell me, are you on a standalone Part D plan or Medicare Advantage? Because I want to make a follow-up video based on what you need. I am Frank. I will be right here watching out for you, and I will see you in the next video with more updates that could save you real money on your benefits.